Good afternoon. This is Scott McGann doing from the Falmouth Health Department doing our weekly COVID update. Today is October 9th, 2020. Our phone number is 508-495-7485. Our email is health@falmouthma.gov, and our website is falmouthmass.us. As of today, there's 282 confirmed cases since the beginning of the outbreak, which for us started on March 19th. And that is everyone who's gotten a positive PCR molecular test. Those are the gold standard. We'll talk about that after. There have been 15 confirmed cases during the period of the last 2 weeks. They go Wednesday to Wednesdays when the state pulls the data, and I'll show you that shortly. The cases have been locally obtained. There's been quite a few asymptomatic positives when people go in for a treatment of some sort, a medical treatment. They get a COVID test. There's been a few of those. There's been some also out of the area, travel related. So it's been sort of spread out, all demographic, all ages. So it's not necessarily been one particular thing. And when I talk about testing, you'll see that we're doing a lot of testing, and that's also will lend itself to having more positives because you catch some of the asymptomatic that you wouldn't be testing. But I'll talk about that in a second. About 95+% of cases are no longer in isolation, and we're about 15% of all cases in Barnstable County, with about 14% of our population being Falmouth residents on the Cape. And of course, the contact tracing and so forth is what we've always been doing, and we'll continue to do that. If we look at our weekly case trend, since about early June, we've been averaging 10 or less cases, with the exception of the lifeguard in one of our nursing homes in the same week. We've been on the higher side of 5 over the last few weeks. But that's where we are for cases for our weekly case trend. So still not like we were seeing earlier in the spring, but I like to see that get lower. Looking at our, since the beginning, this is our graph that shows cases on a weekly basis, and it shows that, you can see where the curve, the sharper the curve, the more cases we're getting earlier in the spring. Then you see a flattening and you see an incline. So I'd like to see that sort of flatten off to a less number of cases. As far as the state's concerned, they come out with this every Wednesday on their weekly updates. Usually comes out around 6 at night. This takes a little while to download all that. You can see that Falmouth still is in the green. Some of our surrounding communities went yellow. Nantucket's had some issues over the last month or so. They're at red. Green and gray are considered low risk. Yellow would be more moderate, and red would be of a higher risk. And we've had some more. If you see, there's a lot more red states than the last time that we've done this presentation. So some of them are college towns. Some of the towns like Amherst, you can see this in red. So sometimes it's the college towns, maybe Dartmouth from UMass Dartmouth. I'm not familiar with everybody, every other town, but you do see it, and you see it especially on the North Shore as well. This is the same update that comes out weekly. I've just cut and paste, our Falmouth specific information. As you can see, as of Wednesday, we had 281 cases. We were on the higher side for our average daily incidence rate per 100,000. If you go all the way to the second to last, you see percent positivity. That needs to stay below 1. It's still below 1, but it's on the slightly high side of that. The good news is we did 2,033 tests over that 14-day period. So, the more tests that you do, the more likelihood that you find. And we do find more asymptomatic positives than we have in the past, and mainly because we're testing more. So if you were a healthcare worker, you're being tested more often than you probably were in March, April, definitely March, but even in the spring or the summer. And some of those are coming out as asymptomatic positive, so the number tends to be on the higher side. So the more you test, generally you're going to find a bit more, but still our percent positive, our incidence rate is a little bit higher than it has been. And nothing in particular stands out to me as saying, oh, that's the culprit one way or the other. There's sort of, a case will bang in that somebody had just went on a trip, or somebody may have been a healthcare worker, or somebody was going in for treatment, or some of it was just somebody got it. And so we do see that. I like to obviously see that, 0.5 or less. The lower the number, the better as far as our percent positivity. Looking at Barnstable County, we're lower than them in the incidence rate and lower than them in the percent positivity. So there's a bit, what that shows is there's been an increase in on the Cape. Barnstable County and Cape Cod Healthcare haven't really seen any reason other than the things I've mentioned. They're seeing the same thing across the Cape as far as people going in for treatments and testing, or some travel related and just random sort of occurrences. Nothing that's really saying that there's some particular thing that needs to change in order to get it go down. So we still remain better than the county. The county's slightly up, everybody, and so in Falmouth is as well. Statewide was not a good week statewide, I think, as far as what we've been doing. Their average incidence rate for the state is 7.3, and they're in the yellow. Their percent positivity was 1.04. But getting back to testing, we're testing more than any other town. We also in Falmouth have a lot of, we have Bramble Bush, and you have all the different medical treatment places here. We have a robust amount of treatment here, and then therefore there's a lot of people going into the hospital to have elective surgeries, knees, hips, and things of that nature. And so there's a lot more tests. And so, we are getting a few more hits on that. As far as the state, 1%, we're at 0.84, and the county was at 1.21. As far as Barnstable County is concerned, if you look at this is the cases by day. You can see sort of an ebb and flow to it. We're not in the 1s, 0s, 2s, and 4s. We're in the 13, 11, and 6s. Hopefully, you can see a slight trend towards the end of the week of the this past week of 6, 3, 5, and 5. Hopefully, that stays down below. If you get less than 10 on the county, or even less than 5, that's a good sign. There's a lot, over 200 and something thousand people. So the total number of cases in the county, if you include the probable, which would be the antigen test, it would be 2,000. It's less than that if you add just the confirmed. We'll talk about that in a second. So the counts are definitely better than they were in April and May. You see some of a spike of that in the July area, then lower in mid-August, and it's peaked up a little bit in September, and then it's gone back down. So you see sort of an ebb and flow to it. And, numbers are relatively low, and hopefully we just keep that down, at a good number. Barnstable had 12 cases. This was Thursday's data because Friday's hasn't come out yet. 12 cases in Barnstable. 1849 is the total number of confirmed tests that's not using the antigen test. So 12. You see some counties like Middlesex is really still struggling with 105 cases a day on that particular day. No deaths associated in Barnstable as of yesterday. During the day of yesterday when they counted the numbers. This is the dashboard that comes out to state every week. The numbers have been, for the last 4 or 5 days, pretty much kind of the same, but anywhere between 400 and 600 positives. Mid-teens, 15 to 20,000 tests per day. 8 deaths. The deaths have been around that 8, 9, 10, 11 per day for a couple days. Total confirmed cases so far is 134,277 with over 4.5 million tests administered. Our status hasn't changed. We don't have any negative trends. The in progress have been the same now for a couple of months. We still need to get the deaths down from COVID-19, and the healthcare system readiness. That's not something I really deal with, but that's still in progress. The rest are still in the green. As far as our percent positivity, that's been going up. The percent positive rate right now it's right around 1. It was just down around 0.8, so that number needs to stay down. You want to keep that definitely below 1. Our lowest observed value was 0.8. As far as hospitalizations, that's definitely had an upward trend. The lowest one we've seen was back around mid-September at 308. We're at 498, so it's a 65% higher than it was on that particular date. And I'll show you the chart in a minute. Surge capacity floats around between 1 and 5, depending on the hospital and what's going on. And our deaths are, been floating in that mid-teen range. We've had a good couple of days that brought it down a bit. Late September it was a little bit higher, so hopefully that trend. We want to see, of course, that trend to go down. And so it's 29% higher than the lowest observed value of 9, and that's what LOV means, lowest observed value. As far as hospitalizations, we're up from September of 109, down total from June of down 397. If you'll see the last few days, you saw 22, 35, 21, and 21 in, and 31 down as of yesterday. So that number is on a slight upward trend. Here locally, Falmouth Hospital, I think the most we've had in the last few weeks was 3 at one time. We're at 0 as of 10/8. Cape Cod Hospital had as many as 6 or 7 with 2 in the ICU. That now this past time I looked at it was at 3 and 0. So, it was still doing okay. We did have, an increase obviously a couple weeks ago at Cape Cod Hospital. Falmouth Hospital seems to be doing pretty well right now, which is great. As far as in the ICU itself, it's been relatively flat. +8 from September 25th and down 5 from August 7th. Intubations have been down 19 from August 7th, down 91 from June, and down 6. This is, on any given day, -6 from September 25th. Our healthcare, long-term care facilities, we've been doing pretty well over here in our long-term care, which is great. They are testing staff and patients on a frequent basis, and so that's been, and that's great, and we're doing pretty well with that. I put on both of the last week's, and this week on the left is last week's total deaths, 6,086. This week it's 6,168. So you can see that a fair amount of the deaths, about 2/3 are from long-term care. That's not anything new. So I was just comparing last week to this week. So a couple hundred cases, and whatever that difference is on that, 14 plus 68 is. And so that's where we are sort of with long-term care. COVID testing hasn't changed. Drive-through testing still at Falmouth Hospital by appointment. Call the dedicated call center, 862-5595. Pharmacies still do it. The walk-in clinic, the pharmacy is CVS in East Falmouth. Convenient MD, like the walk-in clinic there. Community Health Center of Cape Cod also. That's going to be for the PCR test, and that's going to be for the gold standard. You'll start seeing shortly some real rapid PCR tests. So molecular tests are the gold standard, and we're real close to getting that into, I know the hospital has it. Some of the pediatricians' offices, I think, are trying to get some in. Because the cheap, rapid, and accurate is where you want to have your tests. And we're pretty darn close, I think, to getting in good shape with that. Obviously, we're still doing a lot of testing regardless, but the testing that occurs at Convenient MD or the hospital does take a little bit of time, and that's the PCR test. So it could take a couple of days to get your results, which makes things problematic. You need to isolate pending your results, especially if you're symptomatic, right? So if you're symptomatic and you're waiting for a test, you shouldn't be out floating around, right? So that can be problematic. It'd be nice to be able to get that a more rapid way. So that PCR test, molecular test, detects viral DNA. It's the only way to have a confirmed case, and it indicates that you actually have the virus. Either shedding the virus, you could be at the end of your infection and not really be infectious, that's possible, or you're highly infectious, especially if you have symptoms. But it's going to tell you that you have an active or recent infection. Antigen tests have been used. There's the Care Marketplace in Dennis. It's a rapid result. It's using antigens, detecting antigens, which could tell you there's a past or current infection, but it's about a 30% inaccuracy rate, so anybody who gets positive on an antigen test really also should get a PCR. We do contact trace them as probables. That's what we call them in our caseload. The probables do get contact traced like a confirmed. Antibodies, seeing less of those, detect the antibodies in the blood. It tells you that there's a past infection. We call them suspect, but it's really indicating of a previous infection. So it's not really good about, if we're trying to, cull out people and quarantine people and isolate people, antibodies isn't the way to go with it. So I can see us going down a line relatively quick where we get, I've been hearing a lot of good stuff about PCR, rapid, and cheap. So if we can have fast, rapid, cheap, it'd be really nice. Ideally if, with schools, schools have the guidance, and the guidance in schools say that if you have symptoms of COVID, which is a lot of symptoms with other things such as, headaches, sore throat, sniffles, congestion, things of that nature, if we can get rapid tests to figure out whether it's COVID or something else, because most of the time it is something else, but you also don't want to take chances. So it's really a hard battle to fight, to really decide. And so the better we get, the quicker, cheaper, faster, immediate test that we get that's got good accuracy is definitely a good trend if we can get to that point. Flu shots. Well, the good news about flu shots, from what I've been reading, is that the levels of flu has been very low in the Southern Hemisphere. Of course, they've just gone through their winter. They're coming out of their winter. That's usually where we look at what the flu season is going to look like, and it's been quite low. And of course, when you wear a mask and you social distance, that's going to help with the flu or colds or any virus that's going to be out there floating around, because it's going to work. It's mask and social distance is not not just specific to COVID. That being said, you should still get your flu shot. Schools will be required, if you're in person school, required by the end of the year. Where do you get your flu shot? You go to your local pharmacy or your local physician and pediatrician. there's a lot of demand for flu shots this year, so you'll see some pharmacies maybe be out and then get some in because it's kind of coming in drips and drabs. Not atypical, but with the demand higher, it's getting, you know, up and down a little bit more than usual. Usually if the pharmacy got 200, they might be able to get 6 weeks out of 2 or whatever that number happens to be. And this time they're getting more demand, so they're running out of that what they normally would get. As far as us at the health department, we're going to host by appointment only drive-through flu clinic on October 26th with a rain date of November 2nd, so the following week. If it rains on both weeks, we'll figure it out and send it out to everybody, but hopefully we can get it done in either one of those dates. So October 26th from 2 to 5. That's at the Gus Candy Rec Center. You're not going to need to get out of your car. But that makes it a little bit problematic. That's not how we normally do flu clinics. Usually you just come over to the rec center and then you sit there and you fill out your paperwork and hand it in. So it's a little bit different this year. What we need you to do is to call the health department. We're going to schedule appointments. So I don't have, you know, I just did a flu clinic with the other towns, and we already had a line by 6:30 in the morning, you know, because there was some double dose available. This one does not have the double dose. It's just going to be the single dose. I do not have any double dose. But that being said, there was a line, and I do the household hazardous waste every year as well. And you know, the key to if you ever go to a household hazardous waste is to come at 11 o'clock when no one's there because everybody comes early. So to help with the, you know, the early bird, and once that happens, it's hard to get through the line once you've already got 50 backed up. So we're doing it by appointment. We're going to be doing about 20 people, you know, about 20 people every 15 minutes. We have a couple hundred doses, a little bit more. If there's still a demand, maybe we would do a second one. But as it stands now, it's by appointment. You call the health department. We'll take your name and number. We need you to pre-fill out that form because that could help. That also can clog the line as well. If you come to fill out the paperwork and we have to put you somewhere. So please fill out the form. You can get it from us. You can call the health department. Town hall is opening on Tuesday. You can get one here. We can mail one to you. When you call to make an appointment, you can't print one out on the computer. At our website, which is the Falmouth, Mass. 273 Health Department, you just click on the falmouthmass.us, click on the Health Department page on the departments, and that link will be there and it'll bring you to the form you need to fill out. For each person in the car, please fill out the form because that only clogs the lineup. We just want to get everybody in and out, move it quick, and not back up onto Main Street and have the police department mad at me. So if we can mail it, we can do whatever you want. Just tell us when you call us, and you can please mail it to my address, and we'll send one out in the mail to you. Okay? The vaccine, again, is going to be the single-dose quadrivalent, designed to protect against 4 different viruses, 2 types of A and 2 types of B. It's a drive-through. You're not going to have to get out of your car. You're going to hand the form. A nurse from the VNA will come right up and give you your shot. We ask that you leave pets at home because some dogs are defensive, and when you go to stick a needle in somebody's arm, the dog might not be very happy about it, and we don't want to have that problem. Also, wear a short sleeve or have access to your shoulder so we can give you the shot without you having to get out of the car and adjust. Bring your insurance card for billing, although the information should be on the form when you fill it out, just in case there's a discrepancy or they can't read the writing. We have some vaccines for uninsured children, 18 and under. Are also eligible for free state vaccines, so we do have the state. I did get some from the state. And just follow the signs when we get in. You're going to go in through Main Street and have you drive out of Dillingham, so we'll have it in one-way traffic, and we'll have 3 lines, and we'll get you through as quickly as possible. And so if you want to get a flu shot from the health department, that's the way to get it. And again, start by calling us at 495-7485. As far as what phase we're in, started this week, we're in, because we're a lower risk community, a green community, we're at phase 3, step 2, which just allowed an increase in the gatherings to 100 people. They usually had a limit of 50 for outdoor. Indoor gatherings remain at a maximum of 25 people, 8 per 1,000 square feet, no more than 25 people for an indoor gathering. Unless you already have guidance elsewhere, so restaurants and grocery stores already have their guidance, they don't have to follow the general guidance. It allows some indoor and outdoor performance venues, arcades, game places, fitting rooms are allowed, increasing capacity at gyms, museums, and libraries to 50%. So it's some minor tweaking. It's not a big deal, but still sort of real similar to where we were at. But if you have any of these sectors, if you're an arcade owner or things of that nature, and you have questions, we've had, every time the phases change, we get quite a few questions from different businesses or entities. We're around to answer those questions. As far as, again, social distancing and face coverings, again, we don't want to undo what we've already done. For you that know, the high school was closed on Monday due to a party over the weekend that the school had found out about. There wasn't linked to any particular case. There's no active case that we're aware of. Not everybody was Falmouth residents, but you do have that sort of stuff happening. And again, of course, we still have to be diligent. That's usually how it spreads. You know, if you're following football, the Tennessee Titans had 20-something cases within a week. And probably because of indoor sort of, or some sort of thing where they were all together, right? So it's the gatherings, it's the parties. Halloween's coming up. We'll be sending out some guidance on Halloween. One of the things you want to avoid Halloween is a big indoor Halloween party. That would be how it would spread. It wouldn't be nearly as much as somebody going to a door and grabbing, you know, doing the normal trick-or-treat, and it's going to be the indoor activities without social distancing. So again, hand washing, gloves, all that stuff still is, you know, it's really what's kept the numbers where they are at. So we want to continue with it. Health department continues to, you know, we'll follow up on complaints. Because if you're traveling again, don't forget about the 14-day quarantine from most out-of-state areas. And that list can be found at the state. If you're concerned, we do get a lot of calls at the health department to walk people through it. Either you're quarantined for 14 days or you get a negative test within 72 hours. But of course, the last thing you want to do is undo the hard work, all the work that the school department put in, and I include myself helping them, but just to get schools ready to go and, you know, have it all closed up, you know, because of some, you know, events or parties or gatherings or travel or stuff like that is not what we want to see. So as a recap, state metrics have been increasing. The deaths have not, but, you know, there's been an increase in cases. You can see that in the chart with the number of yellows and reds have increased. Our cases remain roughly around that 6 to 10, I should put 10 there, between 6 and 10 cases a week. We are testing a lot of people. We're finding it with people they probably wouldn't have gotten a test otherwise. We do see that. That's like we're going for a hip replacement or a knee surgery or something like that. We're currently in phase 3, step 2. So we're doing okay. There is a bit more cases. Nothing, again, to recap, nothing specific to something that needs to, you know, make changes to any of the guidance that we have or anything we're doing in Falmouth at this point. You know, we watch it as close as, you know, I watch it every day, so we'll react if we need to. So that's our recap, my recap for the week, and we'll see you guys next week. Thanks.